was under the Kasich administration. Then when Dr. Amy Acton was serving, of course, as the Ohio Department of Health director, he had settled into a role as the general counsel, which incidentally I believe is still at least part of the bio on his Twitter page, as I found out today. But serving in this interim health director, not a new thing for Lance Himes by any stretch.
So I wanted to ask you, last week Governor DeWine talked about expanded COVID-19 testing, even tweeting this morning a reminder that every Ohioan can get tested, even low risk, those with no symptoms, and that pop-up testing locations would be available. What is the sense that you might get from the State House maybe today about what that response might have looked like over the weekend or since these pop-ups have come available for people?
Yeah, certainly we'd like to know how popular those have been, because it's something that I have been asking at these briefings, and of course everyone in Ohio wondering, when can I get tested, either to know if I have this or to test for antibodies, which is still not widely available in the state of Ohio yet. So that's a big focus for us, and of course it also lends itself to that kind of nationwide speculation and data gathering that's going on right now about whether or not we're seeing larger numbers because of coronavirus cases, because of testing, or because there are more cases. We'll have to see.
All right, Jeff, thank you. We see the governor stepping up to the podium, taking off his mask. Let's listen in.
Well, good afternoon. The tie I'm wearing today is Northwest State Community College, Northwest Ohio. Archibald. This summer, Ohio's Summer Food Service Program continues to feed Ohio children so that no child goes hungry. Children under 18 can grab a free meal at more than 1,500 sites across the state. My wife Fran visited several summer food sites last summer, including East Columbus Elementary School in Columbus and the Collingwood branch of the Cleveland Public Library. She also hosted the food service program for a few days at the governor's residence. Some summer food service sites may look a little different this year and may be only serving grab-and-go meals. But more than 65,000 children a day are expected to take part in getting that free, healthy meal. It's so important to their growth and to their well-being. For locations and hours, you can call 866-3-HUNGRY. That's 866-3-HUNGRY, or you can go to www.education.ohio.gov, /kids eat. Now let's take a look at a PSA about this program.
This is not a typical summer, but a healthy body still needs good food. This summer, the Ohio Department of Education is again sponsoring the Ohio Summer Food Service Program, where kids eat free. Children under 18 receive free healthy meals and no sign-up is required. Call 1-866-3-HUNGRY to find where you can pick up good food for free. Some locations are right in your neighborhood. Call 1-866-3-HUNGRY or visit education.ohio.gov/kids eat for meal locations and times.
Moving on to sadder news. Sadly, Ohio's correction community is mourning the loss today of another member of their corrections family. Terry Loomis, 62, of Conneaut, had been a correction officer for 18 years with the Lake Erie Correctional Institution, which is a privately operated prison in Ashtabula County. Those at the prison tell us that Mr. Loomis had been hospitalized with COVID-19 since May 24th. This is the fifth COVID-related death of a prison employee. Fran and I extend our deepest sympathy to Mr. Loomis's family. Let me go to the numbers. Briefly review the case numbers, and then we'll talk about the R0 data that we're seeing. To date, 42,010 people in the state have been diagnosed with coronavirus. That's an increase of 434 cases since yesterday. 59 additional people have been hospitalized, and sadly, there have been 24 more deaths from the virus that have been reported. To date, 597 Ohioans have died from this horrible virus. Now, let me just look at the rest of these numbers if we could, for a moment. Again, what we try to do in these key indicators is show the trend lines. The trend line is a 21-day trend. So if you look at cases, the cases are pretty much spot on what they have been on an average for the last 21 days. Not much change there. Not much really in deaths either. Hospitalizations slightly under what the average has been. And ICU admissions yesterday's was 8. The average has been 16. So again, these numbers are pretty flat. And that has been the situation for really well over a month now. During the past several weeks, you heard Dr. Acton, you heard me, you heard the Lieutenant Governor talk about what's called an R0 data. We've talked about how contagious COVID-19 is and how we're monitoring changes in Ohio. The R0 number is the speed at which coronavirus is spreading from one person to another. Without any interventions, without any kind of social distancing or anything else, COVID-19 is estimated to spread at about the rate of one person infecting 2.5 other people. If you look at our numbers, I think ours was actually at one point approaching 3. The Department of Health's data team keeps track of this number and a lot of other data as well. If the R0 increases above 1, if it's above 1, that tells us that we should look more closely at that particular area of the state to figure out what is happening that is causing the increase. This, combined with other data, helps us determine if we need to work more on containing the spread of the disease in a particular area. In March, when we go back in March, for every one person infected with the coronavirus, they were spreading to almost 2 people. In our most recent calculations, we see that the R0 is about 0.87 for the entire state. There's a lag in these numbers. So these numbers are good through June 7th. So these numbers are always back. This is a chart that shows the regions. And we might start with an area that has actually changed, and that's region 7 and 8. And it's now up to 1. But all that really means is that it has plateaued, and it's plateaued at a low level. So that number is really not alarming. It just means it has stopped going down in that region. If you look at Southwest, Region 6, Region 3, these numbers are moving a little bit. They're a little bit down from what we saw the other day. Dayton is down a little bit, but they're in the general vicinity where they were. You see North Region 1 at 0.65, and Region 2, the Cleveland area, 0.73, Region 5 and Mansfield, 0.87, and Central Ohio, 0.93. So none of these are really alarming. Basically, what we're seeing is a replication rate. Again, if it's 1, it means one person is infecting one person. So nothing really particularly alarming about these numbers, and nothing particularly alarming about the numbers we just showed you. But again, what we want to do is continue to watch the movement. And if you start seeing a change in the movement, then it's something that we certainly watch. Again, the Dayton area is down a little bit. We were seeing it over 1 the last time. And again, these are snapshots on a given date. Again, this is back to the June 7th. So again, to keep these numbers where we would like to see them, and these, we just urge everyone to continue to wear masks, continue to social distance, and just be careful as we are opening the economy in Ohio. We've talked about the importance of testing. and our efforts to increase testing in the state of Ohio. Last week we announced a new effort led by our Minority Health Strike Force and the Ohio National Guard and local partners to bring pop-up testing sites to underserved communities across the state. Pop-up simply means they're there for a day, 2 days, 3 days, and they're not there permanently. These are a couple of pictures from Friday when pop-up testing sites were in Columbus. Anyone can come the day of and get COVID-19 testing. They can get it at no cost to them, and anyone can get the testing. People also will receive a community wellness kit that has hand sanitizers and masks that they can take home with them. The next round of pop-up testing is today in Southwest Ohio. So starting this morning at the CityLink Center in Cincinnati at 10 a.m., and this will go now until 3 this afternoon. Testing at this site will continue on Thursday, and it will continue on Friday as well. Testing will also resume at the same site in Cincinnati Tuesday, Wednesday, and Thursday of next week. Again, that's at the CityLink Center in Cincinnati. Also tomorrow at the CenterPoint Health Community Building Institute in Middletown. That's the CenterPoint Health Community Building Institute in Middletown. Testing will be available to anyone from 10 a.m. to 2 p.m. That's 10 a.m. to 2 p.m. In the coming days, these pop-up sites will be in Elyria, Portsmouth, Xenia, and many other locations. In Elyria, our pop-up testing location will be at the Elyria City Hall on Friday, June 19th from 10 a.m. to 3 p.m. In Portsmouth, testing will be available on June 24th at the Compass Community Health Center at 1634 11th Street from 9 a.m. to 4 p.m. Also on June 24th, testing will be available at the Greene County Health Center in Xenia, my home county of Greene County, from 9 a.m. to 4 p.m. There are other locations coming, and we will announce them as we get closer. You can find out more information, or if you want to, again, did not get this data on this or did not write it down, you can go up to coronavirus.ohio.gov, coronavirus.ohio.gov, and you can click on testing and community health centers. And again, in most of these cases, we're doing it in conjunction with local community health centers. But the pop-up testing, again, is something you can go to. You do not need an appointment, and you can get a test. Let me turn to the issue of unemployment insurance. Today is the first day that Ohio has had to borrow money to meet its unemployment obligation during the COVID-19 pandemic. The state has requested basically a line of credit of $3.1 billion in borrowing authority from the U.S. Department of Labor. That total exceeds what we think we will need to pay out in benefits. It is essentially a line of credit, so we ask for greater authority than we currently think that we will need so that we have it just in case we do need it. Ohio is certainly not alone. Other states have been forced to do this. So far during the COVID-19 crisis, states such as California and Texas have also had to borrow money from the unemployment insurance for their unemployment insurance obligations. We have done this before in Ohio. Ohio borrowed more than $3.3 billion during the last recession. States are still obligated to pay unemployment benefits, so Ohio and more than 30 other states borrowed money from the federal government at the last recession. From the time it started borrowing in 2009, Ohio worked diligently to pay down the borrowing balance, and the final payment was made in 2016. I want to talk for a moment again about houses of worship. And again, throughout this virus, houses of worship have not been closed by any kind of order. Houses of worship remain open, but we ask people to be cautious. I came across an article today in today's Springfield News and Sun about COVID-19 outbreak associated with a church in Clark County. Last week, I talked about the great caution that Ohioans should take as they return to in-person services at our churches, our synagogues, mosques, and other places of worship. So again, we want to remind everyone that we have put together some suggested best practices for places of worship to keep in mind as they reopen. That can be found at coronavirus.ohio.gov. These are not requirements, but they are best practices and include some of the following items. Having families sit socially distanced from other families, families grouping together but sitting apart from other families, encouraging members to wear face coverings when they come to church, eliminating the touching of common surfaces such as the collection basket, hymnals, as much as possible. And again, for those who are sick, those who have a compromised medical condition, they should be very, very, very careful in regard to that decision to go to church, and if they do, to be very careful where they sit and who they come in contact with. Today we're announcing a $1 million grant funding to Ohio's local family and children first councils. These local councils serve some of Ohio's most vulnerable children who often need services from many different agencies, such as developmental disabilities, child welfare, juvenile justice, behavioral health. These children many times receive services from multiple departments. Right before the pandemic began, we planned to use $1.5 million from the current operating budget for grants and in-person training for our family and children's first councils. We've listened to the needs of our young people, and so we're therefore redeploying some of these funds to help these family and children's first councils to buy technological devices, tablets, for example, web cameras, wireless hotspots. For many of the youth served by these councils, the changes to routines caused by coronavirus have been earth-shattering, especially for the ones who lack access to technology and who lack access to the internet. As services moved online, some of these youth were left without a connection to their doctors and their needed therapies. For others, such as those in foster care and those in residential settings, the pandemic separated them from their families and their loved ones. These grant resources will help local family and children first councils ensure that our most vulnerable children can continue to connect to the services that they very much need. Since the beginning of the pandemic, we've been encouraging Ohioans who have needed critical medical care to continue to receive it. If someone was having chest pains, we always encouraged that person to go to the emergency room, just as an example. Throughout the pandemic, hospitals have been doing what they can to ensure a safe environment for all patients. Now that Ohio hospitals are opening back up completely for all procedures and surgeries, it is essential that if you need medical care, you should feel safe about that, and you should go and receive that. I came across an op-ed piece that was written this weekend, and I wanted to bring in one of the authors who wrote that. Over the weekend, Dr. Tom Mihalovic, the president and CEO of the Cleveland Clinic, and the president and CEO of the Mayo Clinic co-authored a piece in the New York Times about this very topic. The piece concluded with this: for patients with medical conditions that require in-person care, please allow us to safely care for you. Do not delay. Lives depend on that decision. Doctor, we're glad to have you with us. Thank you very, very much. Interesting op-ed piece. I just wondered if you could just share with our viewers and our listeners really what your message from that op-ed piece is.
Well, thank you very, very much for everything that you and your team are doing. And thank you very much for the opportunity to present some of the opinions that my colleague, John Husted from Mayo Clinic, and I have shared with the broader audience. And the reason why we wrote this op-ed piece is because of our conviction that this topic is of a paramount importance for all Americans. Here in Ohio, we have jointly created a very safe environment and have been able to really mitigate and defend our citizens from the pandemic that has really taken worldwide proportions and that has affected so many lives in an unimaginable way. However, as we became successful in combating pandemic, we have beginning to observe an unintended consequence of asking people to stay at home, to stay socially distanced. And people have developed fear from coming to the hospital, even for the conditions that are potentially life-threatening. We have seen a substantial decrease in the number of patients coming in with diagnosis of cardiovascular disease, heart attacks, and particularly with newly diagnosed cancers. What we know for a fact that those diseases have not gone away. What that means is that people are simply not seeking care out of fear. Hospitals are safe. We have created a safe environment. It's really, really important not to delay care. People need to go back to their physicians, their caregivers, their nurses, and make sure that they allow us to take good care of them.
So, Doctor, we've actually seen statewide then a decrease, and you've seen it at the clinic, a decrease in people seeking, let's say, mammograms or colonoscopies and things like that. Is that true?
Yes, we have seen this, and just to remind everyone who's watching or listening, our best chance to combat life-threatening disease like cancer is an early diagnosis, meaning mammograms, screening colonoscopies are absolutely essential for us to be able to detect disease when it's in its early stages and when we can actually cure a patient. We have seen very many patients who are coming with a delayed diagnosis or late diagnosis or cancer or other conditions that we can simply then not help them to the extent that we would otherwise. So it is really, really important that those regular screening, colonoscopies, mammographies, as you have just mentioned, resume. And I can assure you that patients are coming to a safe environment.
So, Doctor, do you think it is just a fear of the hospital itself, or fear of going out, fear that they're going to get the virus at the hospital? I mean, what do you think it is?
Well, that's what we think it is. And actually, we have asked our question, that same question to thousands of patients here at Cleveland Clinic. And what we've learned during this questionnaire, that more than 60% of them are fearful of coming to the hospital because they are concerned that they might become infected while coming to the hospital. I can assure you that is not the case. Hospitals are one of the safest environments to be in. We here at the Cleveland Clinic have 60,000 employees, caregivers, the way we call them, and fewer than 1% of them have contracted an infection, and none of them in the workplace. Our environments are very safe. We screen every patient and every entrance to the hospital for fever. We all wear masks, and we ask all of our patients to wear a mask. Our hospitals are immensely clean environments, and through all of those additional efforts, we have really been able to create the safest possible environment to receive care.
So final message then, Doctor, is everybody get back in the game, go see your doctor, get your checkup, whatever you need to have done.
Absolutely. We are here. We're here to take care of you. Please come back, resume your regular checkups, contact your providers. Do not miss an opportunity to stay healthy.
Good. Doctor, thank you very much. We appreciate you joining with us.
Thank you very much. Thank you for having me.
Thank you. At a press conference later this week, actually it's going to be on Thursday. On Thursday we'll have Dr. Amy Edwards. Dr. Amy Edwards from Rainbow Babies, University Hospital's Rainbow Babies in Cleveland. She's going to Skype in, and she's going to talk about a troubling new trend that I actually read an article about a few minutes ago among Ohio children and COVID-19. So that will be on Thursday. We look forward to seeing Dr. Amy Edwards. Lieutenant Governor.
Thank you, Governor, and good afternoon. I want to start today on covering something that I spent a little time over the weekend brushing up on both nationally and in our state, and that's a fraud mourning. Unfortunately, there are some people out there who have tried to take advantage of others during this crisis. Well, we have seen most people rise to the occasion, and we've seen their better angels emerge, helping friends, neighbors, serving the people in need across the board. There are some who want to take advantage of us, and it's important that you know what's going on and what you can do about it. I know that some people are being aggressively solicited with offers of fake cures, fake work-at-home offers, messages asking for personal financial information. TransUnion, which is a credit bureau, runs a weekly survey that showed that 29% of consumers, pretty alarming number, 29% of consumers say they have been targets of digital fraud related to COVID-19. And perhaps one of the most widespread scams that's going on nationally, criminals are filing fake unemployment claims on behalf of real people who haven't lost their jobs. Those who haven't lost their jobs, hitting one state after another. The most alarming statistic I saw was the state of Washington, where they had flagged 190,000 claims totaling $650 million of fraudulent attempts to get access to unemployment insurance finances that are not theirs and that they're not entitled to, just pure fraud. I checked with the Ohio Department of Family Services, and recently they started to see this as well. Coronavirus, they have at least 3,000 cases in Ohio where people have attempted to do this in our state, but they're on the job. It's part of the checks and balances that they have there is to make sure that they're not paying out fraudulent claims. And so ODJFS is working to secure your tax dollars and benefits that are due to you and not to fraudsters. The reverse is also happening, unfortunately, that official-looking notices are going out claiming to be from the government that say you've been overpaid, either a stimulus check or an unemployment benefit, and you need to return the money immediately. And they're asking for personal information in an attempt to defraud you. Ohioans, if you have any of these things that you are aware of and you receive information, or if there's a fake unemployment claim that's filed on your behalf, make sure that you check it out, that you talk to someone, that you, if it's an unemployment claim, that you call ODJFS to alert them to this. It's just common sense advice, I guess, is what we have for you. Just know this is out there. Be skeptical, be suspicious if it's an unsolicited call or text. If you think something is suspicious, consult with a family member or friend before taking action. A few places that you can find resources that could be helpful to you in this are at coronavirus.ohio.gov, and go into the search engine and type in checklists, and that will take you to a series of information that you can use to help avoid scams. Another consumer protection resource is at the Department of Commerce website, com.ohio.gov/consumer protection. And if you think you might have been a victim of fraud, or you think someone is attempting to commit fraud against you, I know our attorney David Yost will want to know about that and is there to help at ohioprotects.org. Also, insurance-related fraud claims can be tracked down through the Ohio Department of Insurance. So if any of these things sound familiar to you, you have questions about them, just be aware about this, that these kinds of scams are out there, And it's unfortunate that people would try to take advantage during a difficult time like this, but we know they're out there, and be cautious and use these tools to help sort through it. Now on a bit of good news, in November we announced a partnership from a group that Governor and I helped create, which I run, Innovate Ohio. We try to use technology to improve the way we serve our customers and to use technology to become more productive and really make state government work for you in a much more efficient way. Well, we announced a data analytics project with the Office of Budget and Management regarding duplicate transactions. Every year the state pays millions of transactions, and sometimes they pay them twice. They pay duplicates. In the past, when you're talking about millions of claims, human beings just couldn't track this all down. There was no way for that to happen. But using this data analytics tool, since we launched it in November, we've already identified $1 million in duplicate payments, and thankfully have tracked down all but 50,000 of those. So $950,000 worth of those duplicate payments have been tracked down. And you ask, how common is this? Well, just since we started, 107 times we've identified it in 27 agencies, boards, and commissions. And this is very common in large organizations, in the private sector, and in the public sector. But we're doing something about it. We have a data analytics tool that is now doing things a much more productive way, in a way that the people who work there could have never done it before. And whether it's fraud or duplication, just understand that we're aggressively deploying these technology tools to protect your tax dollars and to protect you as taxpayers in this state. And so that's a bit of good news. And we think that it's hard to tell how much of this happened in the past, but we are tracking this down now, and are going to make sure it doesn't happen in the future. A bit of good news, and we are optimistic that as Innovate Ohio technologies continue to permeate the state platform, that we will have other kinds of announcements like this in the future to improve the way we serve you. So thank you. Governor?
That was good news. Now we're ready for questions.
Sorry, I was in the back of the room. This is Jessie Bulmer with the Cincinnati Enquirer. My question is about nursing home testing. Obviously, this has been going on. Do you know how many residents and workers have been tested, and what have you been learning from that nursing home testing?
I apologize. I'm having trouble.
Question is about nursing home testing.
I don't have those numbers, but I talked to General Harris today about that. Nursing home testing is going on. It's going on today, and we will give you an update on the numbers when I come in on Thursday. We'll give you the update on Thursday. We could probably get you those numbers actually today from our press team.
Testing so far?
It's a work in progress. I mean, basically what we're doing, the protocol is we are going in and testing all employees. We are then letting the clinical people make a determination based on the facts of what is going on inside that nursing home, who else is tested. So in some cases it might be a wing of residents. It just depends on what the clinicians, from a medical point of view, what they decide who should actually be tested inside that nursing home. So the goal is we're going to go through the nursing homes, all the nursing homes in the state, and get that testing done. Then we're in the process of working right now with the nursing homes in regard to what the second round of testing will look like and how that will take place. That's not yet been determined.
Hello, Governor. This is Luis Gill with Ohio Latino TV. Governor, many leaders are willing to change, sign referendums, bills, because of the crisis is happening, virus and the protesters. Millions of dollars are coming out in the local level, state level, and federal level. these millions of dollars are coming out where we have been overtaxed all those years, or are we expecting to have new taxes down the pipe in the future?
We've got to do something about the echo. I know the viewers can't see this, but the members of the press corps are assembled in the State House, and we continue every time to get a real echo, and it's very, very difficult. And so I apologize. Eric is going to see if he can work his magic here to get us a better reception. So I apologize. No.
Do you want me to repeat
Eric,
the question?
Try it again.
Yeah.
Let's try it again. We apologize.
Okay. Many leaders are willing to sign into law referendums, reforms for mainly police departments. And new taxes, new money is coming out for organizations to trying to band-aid some of the issues we're facing. Have we been overtaxed when all those millions of dollars are coming out, or we expect to have new taxes coming down the pipe in the future?
I think everyone is looking at reforms. In fact, tomorrow I'm going to have a press conference right here at 2 o'clock with the Attorney General and members of the state legislature, and we're going to talk about some of the reforms that I'm going to propose. I think the other issue, when you talk about the money side of it, that communities are in fact looking at, is making sure that the resources are spent also on the whole area of people who have a mental health problem, people who maybe have a drug problem, and to make sure that there is the right balance between how we deal with that particular individual. Too often, and this goes way back, this is not new, it goes back to at least to when I was an assistant county prosecuting attorney, and we would see police dealing with things where they really were not prepared to deal with. They did not have the background, and they had to be almost a social worker at the same time that they were a police officer. So how we tackle that, I think, and the money that we spend on it, on both of those issues, is where this debate is going in the country. I said the other day that the idea of defunding the police makes no sense. We have to have a police force, and it's important for that police force to be trained and to be very well trained, and to be trained in de-escalation, to be trained and understand their people do have implicit biases that they sometimes don't know that they have. It's important to have a central standard, a good standard of when use of force should be utilized. But it's also important to figure out how the people that the police are dealing with many times who have other challenges, other problems, that they're getting the assistance that they need. One of the things that I saw as a prosecutor, one of the things I saw as an attorney general in dealing with the opiate epidemic is police working with people, the social work people on that side of it, to come up with some solutions. And so we saw the quick response teams all over the state run by local police departments where they got people into treatment. It's that type of putting those two disciplines together that I think we need a lot more of.
Thank you.
Good afternoon, Governor. Aaron Portzline with theathletic.com. The Pro Football Hall of Fame in Canton, while keeping its options open, is hoping to proceed as usual in early August with 20,000 fans in attendance for both the Hall of Fame induction ceremony and one day later an NFL preseason game. That would seem to be the largest gathering in Ohio since the COVID response began in mid-March. From what you know today, how reasonable is it? How safe would it be 7 weeks from today for crowds of that magnitude to gather?
Well, as much as I hate to say this, because we've all been looking forward to that, and I know how much it means to the Canton area and the Stark County area, but really across the country, it is a great, great event that we've been looking forward to. Having a crowd that size, I think, is highly unlikely. Certainly, it could not occur today. It would be very dangerous to do it today. So again, we have to see where we are at that point. But that's a large crowd, a lot of people together. These are the things that we've talked about all the way through this. That as we open Ohio up, and we get back to work, and we get back to doing the things that we like, that probably the last things that are going to be able to be open are the big crowds, particularly when you have big crowds that are close together. So we have to continue to look at it, make decisions as we move forward. But if the question was, could that event occur today, the answer would be no. It would just be extremely dangerous. It would not really make any sense to do it.
Governor, just wanted to also know that we're in regular conversation with the Pro Football Hall of Fame on hearing alternative plans and engage in that dialogue. So I just want to make sure that you know that we're having ongoing conversations with them about what success could look like.
And I think if we could, we could broaden the question to include other sports. There's negotiations going on. Major League Baseball and the Players Union, they've come forward with a plan to play baseball this summer if they can reach an agreement. A plan that possibly could start baseball as early as the first part of July, playing with no fans. That is a prospect, something that makes sense. That's something that could be done. They have a very elaborate plan, a plan that makes sense, and they could do that with no fans. I know other people are looking, for example, the minor league ballparks are looking at other things to do in the ballpark with no baseball. And, there are certainly possibilities. You have a lot of space, and, doing things where people could be spread out. It is outside. So those are things that I know some of the minor league ballparks and teams are looking at doing, which certainly makes sense. Again, they're outside, and as long as you can spread people out, there's certainly things that you could do.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. I wanted to talk a little bit more about unemployment compensation and borrowing from the feds. Do you happen to know how much Ohio will have to pay back in interest? And are you calling for the House and Senate to come up with some type of reform to the unemployment compensation system to make it solvent?
Well, we've known for a number of years that this is a problem that has to be addressed. It's a lot easier to address it when the economy is going up than it is when the economy is not up. So it's difficult, I think, to address at this point. The good news is that at least at this moment, there is no interest being charged by the federal government. So that's a happy thought, and that we're able to borrow this money. Obviously, we would, I think the best way to describe it, Andy, is that we've got a long-term structural problem that needs to be fixed, and needed to be fixed prior to the coronavirus additional problem and the economy going down. So that structural problem remains out there. It obviously has not gone away. It has to be fixed in the long run. We would have, without that structural problem, still had, with this down economy, a big problem, and in all likelihood would have had to borrow money anyway. So in the long run, clearly has to be fixed. Probably easier to fix as the economy is moving back up than when the economy is flat.
Adrienne Robbins, NBC4, and my question's for the governor or the lieutenant governor. As we see other states have their coronavirus cases begin to rise, have you looked at all what Ohio would do if we head down that same path, whether it be a pause of the reopening or even a rollback of some of the reopenings we've seen?
We certainly are looking at that, but we hope not to face that choice. But we have to always prepare for the worst, and so we are looking at that. Not really ready to share that yet because we haven't quite worked it out. But I think a lot of this is going to come down to trying to get information to Ohioans that is local information. And we are, as you start to see, we're starting to put out, we put the data up today on the RNOT. We're going to continue to put other data up, and we're going to continue to try to refine it so that it gets down to not just the region, but that we can take that data down to the county and sometimes down even maybe to the zip code. So as we look towards the future, what we're going to be looking for in Ohio is the areas where there are a problem. And we're going to try to look at those areas and deal with those areas and work with local officials. These are decisions that are going to have to get made in conjunction with the state and the local community. We will have, for example, within the next 10 days guidelines for schools, but each school is going to be different. And just like in a typical winter where you might have the flu that hits a school district or part of a school district, and the school, certain elementary school, because of flu there, might have to close down, that is a local decision. So getting that data to local officials, to local communities, is part of what we have an obligation to do, and we're going to continue, we have people working on this to continue to refine that information down. So we hope we don't have to close anything, but what we clearly owe the people of the state of Ohio, what I owe the people of the state of Ohio, is to give them the best information we can, so that if you are in a county and there are things going on in that county where this COVID is spiking up, you know that, and you know all the data connected with that, and you know if that is something that you should take very, very seriously and take action.
Governor, if I could add just one more thing that is of value to this, is that that's why we've been giving the best possible guidance we can to employers and people on what they can do to prevent the spread, whether that is the distancing, the masks, the disinfecting, all of those things that we keep saying. It's really up to all of us, our personal responsibility and our collective responsibility. And I want to add that that's why, under the governor's leadership, the testing has been so important. Testing, putting the testing in the places where we're seeing the spread, making sure that we're trying to mitigate that. It's another tool in the toolbox to help Ohio avoid what you're seeing in other states, and we hope it's successful.
And just to conclude on that, what we know what the tools are. We know it's the distancing, it's wearing a mask, it's the sanitation, washing the hands. These are things that 11.7 million Ohioans can do every single day, and be careful, that will keep us from ever having to answer the question that you just asked. And so we don't want to ever get there. And that's really within the hands of the people of the state of Ohio. My obligation is twofold. One is to get as much facts out from every source we can to the people of the state of Ohio. And the other thing is to continue, frankly, to work on the testing and get more testing. That's why we've deployed the National Guard. We're going to use every tool we can to increase testing as we move forward. And that's my obligation to do that.
Hello, Ben Schwartz with WCPO in Cincinnati. Governor DeWine, to kind of go off the previous question, I want to ask, if the state of Ohio were to see a surge in coronavirus cases, if you're able to speak on the role Dr. Amy Acton would play in your administration during that compared to Lance Himes, the interim director?
Well, they're both great people. They both have great experience in public health. I have confidence, a great deal of confidence in both of them. They are also part, frankly, of a team of a lot of people who you don't see, who are not the face of the health department, but who work diligently every single day to give us the best data and best information that they can. So, Dr. Acton, as I announced the other day, I'm very pleased that she agreed to, continue to give me advice. And so, she will certainly play a significant role in any kind of decisions that we made moving forward. But again, we all share the same goal, and that is not to shut things down. And we have this within our control. And by our control, I mean collectively all Ohioans. If we do what we need to do, if we're serious about this, and we can slow this spread down. So it's, we got to have more people, frankly, have facial covering when they go out in public. We just need to do it. And so let's all try to work together to avoid having the situation where anybody has to make any decision like that at the local level or at the state level.
Thank you.
Hi, Rick Ruan from the Columbus Dispatch. Governor, have you actually started the process of searching for a more permanent director for the Department of Health? I know Director Himes is in an interim status right now. And what is your timeline for that? And are you seeking somebody who has similar public health experience and is a doctor like Dr. Acton is?
Well, we certainly want someone with public health experience. We are doing a search that is not just confined to Ohio, but is a nationwide, and that has begun. But it's only been a few days, so it's a work in progress.
And do you have a timeline for that?
I do not have a timeline for that, but we've started it.
Thank you.
Governor Tom Gallick, Gongwer News Service. There's been a lot of discussion in the legislature and at the State Board of Education about the potential for giving local education officials the final say over how to reopen and whether to reopen in the fall. Would you back legislation to that possibility?
Well, we're put aside any discussion about legislation, but we are very much a local government state. We are also a state that takes a great deal of pride in our local schools, over 600 school districts throughout the state, very, very diverse, some extremely rural, where almost everybody's bussed in, and some that are urban and some suburban. So we have a great mix of schools. We have local school boards. We obviously have the superintendents and principals and teachers. So we're going to be putting out guidance from the health department and from the Department of Education 10 days or so from now. And that's going to kind of outline what the ultimate goals are. But a lot of the decisions, frankly, are going to be made locally, be made by that local community. Because that has been the history of what we've done with our schools in the state of Ohio. So we look to going back to school in the fall. The schools are, because every school is different, every school building is configured different, every school population, culture, communities are different. There's going to be a significant amount of flexibility for these schools when they make decisions going forward in the fall.
Thank you.
More on that, in a few days.
Hi, Governor. This is Molly Martinez with Spectrum News. I'm told I am the last question. You mentioned that sadly we've lost another correctional officer to COVID-19. I was wondering if we had the numbers of how many of those incarcerated either have COVID-19 or have died of COVID-19, and are we still carrying through with the compassionate early releases for those that are within 90 days, the program you mentioned sort of at the beginning of this crisis?
Yes, we are. And just to recap for everyone what that program does, there is a statute passed by the legislature some time ago which says the director can release someone if they're within 90 days of the date of getting out. Once they get within 90 days, then the director, because of overcrowding, can release those individuals. I have added to that, though, a filter, and that filter stops people who are sex offenders and other people who, we would not want out one day earlier than they have to be, and stops them from going out. But that program continues, and it continues to help us with the population, with the crowding that's going on in the prisons. Those individuals are tested to determine, whether or not they have the virus or not, and appropriate action is taken, based on that. If they have it, they're obviously not released. In regard to getting the data, yes, we can get you the data. I do not have it in front of me, but we can give you the number of fatalities there have been, a number of prisoners who have died, and we'll get you any other figures that we have in regard to COVID-19 in the prison.
Thank you.
Well, thank you, everyone. We look forward to seeing you tomorrow at the same time. We will have a special press conference. The Attorney General, David Yost, and I will be here. We'll have a couple of our legislators Skyped in, and we will talk about some reforms and ideas that we all have in regard to policing. So we look forward to seeing everybody tomorrow. Thank you very much.
Governor DeWine wrapping up his latest briefing. He said he'll be back tomorrow. There are now more than 42,000 total cases of coronavirus in Ohio. Nearly 2,600 people have died statewide, including a Lake Erie Correctional corrections officer. He's the fifth prison staffer to die from the virus. Today, Governor said the numbers remain fairly flat, and Ohio continues to flatten the coronavirus curve. He also says the rate of infection appears to be low. Another thing to note about this news conference, he said within the next 10 days, guidelines for schools will be announced, but each school is going to be different. Of course, we will have that information when it does come out. If you missed any of this news conference, you can watch it on our website, ABC6, onyourside.com, and on our YouTube page. Just search for WSYX ABC6. We'll see you at 5.